Morning, everyone. It's Boris Johnson's much-heralded Freedom Day in England as lockdown restrictions are lifted. But the PM and his Chancellor will spend it in isolation after coming into contact with the Health Secretary who has COVID. Of course, we know the pair hadn't initially planned to stay at home, but were forced into an embarrassing U-turn. Any euphoria Mr Johnson might have hoped for is being overshadowed by anger at the so-called pingdemic, with 1.7 million people self-isolating after being contacted by the NHS app or by Test and Trace. Our chief political correspondent John Craig reports.
There may be worse places to self-isolate than Chequers, the Prime Minister's 16th century grace and favour mansion in the Chilterns, but this is not where Boris Johnson wanted to spend so-called Freedom Day, as lockdown rules in England are finally eased. And yet, after admitting he and Rishi Sunak did look briefly at avoiding isolation, and despite a humiliating U-turn, the PM is now urging the public to follow the rules and be cautious.
I know how frustrating it all is, but I really do urge everybody to stick with the programme and take the appropriate course of action when you're asked to do so by NHS Test and Trace.
Coinciding with the PM starting his isolation, the government has announced that frontline health workers are to be spared self-isolation rules in a move to tackle the so-called pingdemic. From today, fully vaccinated NHS and social care staff identified as a close contact of a case of COVID-19 by NHS Test and Trace will be able to carry on working after a negative PCR test and daily negative lateral flow tests. But while this move will be widely welcomed, the Labour leader says too many restrictions are being lifted today.
We can already see that the infection rates are going through the roof. We know what's going to happen with hundreds of thousands of people being asked to self-isolate. The Prime Minister is essentially putting the whole nation into a car, pressing the accelerator and taking the seatbelt off.
But senior Conservatives are calling on the Health Secretary Sajid Javid, who tested positive on Saturday, triggering the PM and the Chancellor's isolation, to bring forward from August the 16th the date when all double-jabbed people will be able to escape isolation after a negative PCR test and end the pingdemic. John Craig, Sky News.
Well, I'm pleased to be able to tell you that the Vaccines Minister, Nadhim Zahawi, is joining us this morning. Mr Zahawi, many congratulations on the vaccine rollout. It seems to be going great guns. Freedom Day today is what we've been told. Are you veering more towards elation or trepidation for the days and weeks ahead?
I think, look, throughout this pandemic, we have faced different challenges, and the vaccination programme has demonstrated this country's ability to rise to that challenge. The incredible coming together of the NHS, our armed forces, local government, the private sector. 80,000 vaccinated volunteers came out of retirement, BA staff joining the vaccinated army, and of course, many, many hundreds of thousands of others who volunteered to usher people through the vaccination centres. We all want to return to normality. This is a virus that is highly infectious, respiratory disease virus, aerosol transmitted. So we have to be careful. We have to remain vigilant. Our border controls remain in place. Our expectation and recommendation that people in crowded places continue to wear masks and take both personal and corporate responsibility in doing so. And it's great to see TfL and others doing that. So it is step 4. It's an important step. There is no perfect time to take this step. This is as good a time as any, as Chris Whitty has said, with the summer holidays and schools being out, which will hopefully bear down on the R number, the transmission rate. So I'm confident that we're doing the right thing. Almost 88%, just shy of that, 87% have now had the protection of 1 dose, and 68% of all adults have the protection of 2 doses. So I think the vaccination programme has allowed us to take this step, take it cautiously, with this wall of protection of adults in the United Kingdom.
OK, that was a very long answer, wasn't it, to my question? I'm not sure you answered it, though. Elation or trepidation for the weeks ahead?
Cautious optimism is probably the way I would describe it. I hope that helps, Kay. That's a shorter answer, and I hope we can.
Let's leave it at that before you go any further. You talked about masks. We heard Prince Charles saying he doesn't want to wear a mask, and Camilla's not going to wear a mask. Are you going to wear a mask?
So I will wear a mask in crowded indoor spaces. I will wear a mask if I'm on a train carriage that is crowded, because not only will it obviously protect myself, but it'll protect others around me. I don't know if someone sitting next to me is immunosuppressed or immunocompromised, and to put them at risk unnecessarily with a virus that I know transmits very, very effectively through aerosol transmission. It's a respiratory disease, highly transmissible. So I would absolutely wear a mask in crowded places.
Okay, so the future king is wrong then to say that he doesn't want to wear a mask?
No, I think, look, the guidance are clear. In indoor crowded places, it's the right thing to do is to wear a mask, and it is recommended. And we are asking people to take responsibility, and of course, organizations, whether it's TfL or others, to take corporate responsibility. The supermarkets have come out around how they want their customers to behave in the supermarkets. This is important. We all want to go back to normal, but part of going back to normal is having to deal with some of these difficult situations. And I think it's right that individuals and corporations and public institutions do that and think it through. By doing the right thing, we've got to control and transition this virus from pandemic to endemic, as I think we will begin to do so with a booster campaign in September as well, which we can talk more about.
Question, should we? We've got lots to get through, including this pesky pingdemic. 1.7 million people are presently self-isolating. You are looking at trying to change that for some people who work for the NHS. Explain that to me simply, if you will, because I was reading it this morning. It's a bit complicated.
Yeah, no, absolutely. Okay, so for NHS frontline and social care staff who have had the alert, if they are double vaccinated, then they can work with their employer to take a PCR test. And if they are negative, then they can go back to work without having to self-isolate, being careful, being precautionary, not being close to people who are extremely vulnerable to the virus. But this will allow the NHS and social care to cope as we, of course, transition this virus, as I say, from pandemic status to endemic status. So it's an additional way of helping the NHS and social care to do that for those staff who are double vaccinated.
From when?
So we've announced it today. So it begins immediately for them to begin to be able to, if they are double vaccinated, go back to work without having to isolate. Of course, they have to take a PCR test, and that has to be negative. If it's positive, they have to obviously then isolate for that 10-day period.
Yeah. What about people who work in supermarkets or people who work in factories? Because we've heard from people like Marks & Spencer, Sainsbury's, Iceland. They've said that they're on the knees and they don't have enough staff working. Factories are the same, making our cars, etc. Are you going to have exemptions for other key workers as well?
So I just want to say to, obviously, key workers and businesses, small, medium and large, is that it is difficult. This is hard. This is not a normal year. And the NHS app has proven its worth, saving tens of thousands of lives, hundreds of thousands of people identified and asked to isolate. It's an important clinical piece of advice to people who come into contact with someone who has then tested positive. So it's important that we work together to try and get to hopefully the 16th of August, when actually, if you're double vaccinated, you don't need to self-isolate, and that will also help businesses further. The reason for the gap.
Bring the exemptions forward. Are you going to have exemptions for others as well, or is it just going to be for the NHS until the 16th of August?
So at the moment, it's for the NHS and for social care staff. These are important. Clinical care is incredibly important at this any time, I would suggest. But the 16th of August is also for the rest of the economy. The reason for the gap is to allow more people to be protected with 2 doses. We aim to get everyone protected with 2 doses by the middle of September if they've taken their dose. We've now met the target of offering the vaccine to every adult ahead of the 19th today.
I think you've had 3 Weetabix this morning. I can't get a word in edgeways. Tell me about the fact that by the 16th of August, we might not have any food on our shelves in the supermarkets if this app keeps pinging away. Why won't you look at other sectors as well?
Well, as I said, it's important that we protect the NHS and social care because they're offering protection to the most vulnerable people in our society.
Yeah, we need food on the shelves, though, don't we, Minister?
I don't disagree with you. All I'm saying is actually it's important that we work together. I think businesses are rising to the challenge. Many of them, I know my colleagues in the business department have been talking to, for example, the hospitality sector, the entertainment sector, who are opening up as of today, where we're working with them to make sure that they use the app. By the way, it's really worth noting that since the 17th of May, when we developed the app pass for the certification, 6 million people have actually downloaded the app. And last month, 2.5 million people. And they're not just using it for the COVID bit. They're using it to order their prescriptions. Over 1 million prescriptions ordered. Sure. And of course, GP appointments.
When we had the Chancellor, sorry to interrupt, we've only got a little bit of time left. When we had the Chancellor in the back of our cab last week, he said that you were going to be looking at the sensitivity of the app. Are you?
So when the app was developed, it was developed in a world with no vaccines at all. We're now, as I said, almost at 88% of all adults having the vaccine. We review the app all the time. I think the important thing is that the clinical advice to people, if you've come into contact with someone with COVID, remains our priority through the app. That's the right thing to do. And then, of course, to make sure that we continue to review the quality of that detection radar system. Okay. All the time. But look, we take nothing for granted.
What I don't understand, Minister, is what you can do to change the app. Because, the app says if you are within 2 metres of somebody for 15 minutes, then you're going to have to self-isolate if they then suddenly find themselves, sadly, with COVID at home. So how can you actually change it? How can you change the sensitivity of it?
No, so what I'm trying to say to you is I think the right thing to do is to continue to clinically advise people with that sensitivity that they have come into contact with people who have tested positive. The difference now is that we've got almost 88% people with 1 dose and 68% of people with 2 doses. So we can take decisions like we've just done with the NHS and social care staff. We can make decisions that on the 16th of August, anyone who's double vaccinated doesn't need to then isolate if they are pinged and if they don't test positive for COVID. So those changes are happening because of the vaccination program.
Yeah. You were looking at vaccinating some kids. Why not all of them? They're pesky little super spreaders, aren't they?
So the Joint Committee on Vaccination and Immunisation have just delivered their advice. We'll consider it. In fact, after my morning round, we have a COVID-O and then I will make a statement to Parliament. But suffice to say, they've looked very closely, especially at children who are more vulnerable to serious infection from COVID, children who live with adults who are more vulnerable to serious infection from COVID, and of course, 17-year-olds who are close to becoming 18, so 3 months from their 18th birthday. And we will take that advice on board and I'll make a statement to Parliament later today.
And why not all the kids, as I was saying? Why not all children?
So the JCVI are continuing to review that. There's now emerging data of all children being vaccinated in America and elsewhere with the first dose, not yet enough data with the second dose. So they want to look at all the data. There is a very rare signal around something called myocarditis, which is an inflammation of the heart. And on balance, I think the JCVI are coming down on the side of continuing to review all children, healthy children, but actually wanting to protect the vulnerable children first.
OK, just before I let you go, on my way to work this morning, about 3:45, there were an awful lot of very relaxed young people in central London celebrating after the clubs opened at midnight last night. When was the last time you went to a club?
Oh, my goodness. When was the last time I went to a club? Probably a couple of years ago on holiday. But the important...
Where did you go?
Stop it.
So the karaoke bar or something?
No. It was a good club. It was actually a club I think it was in Dubai, but pretty impressive. But nevertheless,
racy, doesn't it? Sounds very racy for a minister of the government.
Anyway, the important thing, Kay, is that we're working with nightclub operators to use the COVID app both for testing and, of course, for those who are vaccinated, so that we continue to safely enjoy nightclubbing in the United Kingdom. The important thing is the businesses, and I know my business colleagues are doing that. Paul Scully's doing that with the sector at the moment.
Well, I know a few clubs in London. Next time Mrs. Z is out of town, give me a ring and I'll show you a good time, Minister. It's good to talk to you. Thanks for joining us on the programme this morning.
You're on.
OK, it's a deal. Don't get that on the other channels, do you? Still to come on the programme for you this morning, as England eases lockdown restrictions, we'll discuss the rising number of new cases of coronavirus with Dr. David Nabarro from the World Health Organization. That's at 7:30. From today, double-vaccinated NHS and care staff in England will be allowed to avoid self-isolation. We'll talk to the Shadow Health Secretary, John Ashworth, at 8:05. And we'll find out how senior scientists view today's decision to ease lockdown restrictions in England. Professor Andrew Hayward, he's a member of the SAGE committee, will be with us at 8:20. So from today, the lockdown is all but over in England. Nightclubs are open, as we were saying, and there's no limit on the number of people who can attend weddings and funerals. Restrictions are also being eased in Scotland. Let's just remind you what's changing and what's staying the same. Here we go. You'll be able to go to a club or a non-distance concert, have however many guests you want at an event, and order a pint at the bar. But the government still wants people to be cautious. It says people should still wear a mask in some settings. It's also calling for people to limit some social contacts and to check in at events or pubs. And you will still have to isolate if you test positive or are contact traced, while quarantine for travellers from red list countries is staying in place. Ivor Bennett reports.
They are restrictions we have all got used to. But after 16 long months, in England, they are legally no more. Social distancing can be distanced. Masks are now optional, but still required in some places. Lockdown, technically speaking, is unlocked.
Fantastic, you know what I mean? It's just freedom again.
You can't keep life on pause forever. At some point, you've got to find a balance.
We've just got to get on with it. It's never going to be a good time, really.
Hey, 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 1, 2, 3, 4, 5.
But it is undoubtedly a good time for cultural venues like London's Royal Albert Hall, which will reopen tonight with a full capacity for the first time since March last year.
For concert halls like this moment couldn't have come soon enough. Audiences are essential for both the performance and the finances. But when this place is full again, with more than 5,000 people inside, it will probably feel very strange indeed.
It's going to be strange to observe, strange to be in the audience, strange to be on stage, and I think very emotional for our staff, our stewards, our crew, all the performers and the audience. We've not been in this situation for so long. It's going to be very, I think, exciting, exhilarating and odd all at the same time.
All adults have now been offered a first dose of a vaccine, but there are still those who are classed as vulnerable who aren't fully protected. Campaigners say the vast majority of pregnant women are yet to have 2 jabs.
The government has ignored pregnant women throughout this pandemic, sadly. We have seen at every stage of the guidance and every stage of policy making that pregnant women have just been a completely forgotten cohort, and their levels of anxiety are terrifying.
There's unease too among some scientists, with fears the soaring cases could translate into deaths.
If people remain cautious, then the numbers of deaths that we see, maybe in the region of 30 or 40,000 deaths in the next year. But this could be many, many more if people go back to near the sorts of behaviours that we had before the pandemic in terms of mixing.
The government is urging caution as it dispenses with the rules, affording freedoms, but not in the way it had hoped. Ivor Bennett, Sky News.
Well, our business correspondent Paul Kelso is at Didcot Parkway Station in Oxfordshire, travelling into London. And Becky Johnson is at Birmingham New Street Station for us this morning. Hello to you both. Lovely to see you. Becky, to you first of all. What's it looking like?
Well, you know, it's really interesting. This train just about to depart to Nottingham this morning nowhere near full, you know, considering that people can return to work from today. We're seeing nothing like the kind of numbers of people at Birmingham New Street Station that you would have seen on the morning commute pre-pandemic. Also, face coverings. I would say at least 80% of people that we've seen passing through the station and on the trains here this morning still wearing face coverings. The station staff are, the train drivers are. I asked one woman who got off a train why she was wearing the mask, and she said there had actually been tannoy announcements during the journey asking people to keep their face covering on. We know in London, of course, Transport for London making it a condition of carriage. Here in the West Midlands, the Mayor said he would expect people to still wear masks on public transport out of respect to staff and to vulnerable passengers. So actually, to be honest, it doesn't feel that much different than it would have done on Friday here.
What about where you are, Paul? Is the pingdemic doing its damage there?
It does feel a little bit like a slightly different picture to Birmingham. This is Didcot in Oxfordshire. It's on the West Coast Main Line into London, so a busy commuter route. There's a 6-storey, multi-storey car park here, Kay, for commuters to park in. There are 13 cars in it this morning, and one of them is mine. That gives you an idea of the nature of the return to work. It's a pretty funny freedom, isn't it, that celebrates a return to commuter trains, and people just aren't coming back in any kind of numbers compared to back in March last year. I'd echo what Becky said. Face coverings, 80% at least of people I've seen wearing masks. I'm only not wearing mine so that you can hear me a little more clearly. GWR, who run these trains, say they expect passengers to wear them out of respect for fellow travellers, but there's no mandating of them. But you wouldn't know it from around the station. All the signage still talks about masks. We'll wait and see what it's like when we get into central London, where there is no expectation that there will be a rush back to work just because the government has removed the advice to work from home.
OK, thanks. It was interesting, Paul, to see the guy behind you didn't have his mask on, just about to get on the train, and has decided to put it on. I'm sure that's what a lot of passengers will be doing. Thank you both. Appreciate it. We're also hearing from the Minister, weren't we, just in the last few minutes. He said he is going to be wearing his mask in enclosed spaces. Also making the news for you this morning. Officials in Siberia say wildfires there have grown by nearly 250,000 acres in the last 24 hours. They've warned the region is experiencing its driest summer for 150 years. More than 2,000 firefighters have now been brought in to help fight the blaze. 3 people have died during yesterday's hot weather across the UK. Greater Manchester Police recovered the body of a teenager from Salford Quays. A man in his 50s died in the River Ouse near York, while a teenage girl died in water near Witney in Oxfordshire. Government ministers in Australia say they're deporting the controversial British commentator Katie Hopkins after she bragged about breaking quarantine restrictions. Hopkins was due to take part in a reality TV show when she boasted on social media about meeting hotel staff, which is against the rules.
The Australian Border Force acted very quickly to make sure that the visa on which she entered was cancelled. So there was obviously a bit of a process that we needed to follow with that. We will be getting her out of the country as soon as we can possibly arrange that. So I'm hopeful that that it will happen imminently.
In other news, the German government has pledged nearly £250 million to help flood victims. A massive clean-up operation is underway right across Germany, Belgium and the Netherlands this morning. Our Europe correspondent Adam Parsons is in Germany for us today. Hello to you, Adam. Looking behind you, I mean, I've covered many floods here in the UK, nothing to that level of devastation. How are people coping?
Oh, this is Ahrweiler in western Germany, and you arrive here and the first thing that hits you is almost the smell, and you work it out. It's like being in a seaside town, but of course it's the smell of mud. Everywhere you look in this ruined town there is mud around you, and signs of the ferocity of these floods. Look at this sign. This has been bent completely out of shape by the power of the water. This deep mud here, but I want to show you something that I think brings home just how devastating this was. That mark up there, way above my head, that is where the water reached up to. Just imagine that flood coming through here and sweeping everything in its path. Look at this. This is a very hefty bit of metal furniture, and that has simply been thrown down the street. And here's another example of the ferocity of nature here. This a state car, every window is smashed. The car in front of it, and look through the back window there. Just look at the mud that has been piled into that. Well, the German government, is talking about supplying hundreds of millions of euros. Let's be frank, it's going to cost a lot more than that to repair all this damage. Angela Merkel was just down the road yesterday talking about the need to develop a plan imminently. At the moment, the German people, I think, support that, but they will want action fast.
OK, Adam, for now, thank you. Of course, we'll update you throughout the course of the day on what's happening in Germany. Weather extremes, sunshine here in the UK. Naz is standing by. Hottest day of the year so far yesterday, I believe. Naz, what's planned for today?
It's still remaining hot, Kay. This week we're going to continue with the heat. Some areas have already met their heat wave criteria, so the heat wave continues for some spots as well.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Good morning. It was a hot and sunny weekend for many areas, and the heat continues for this week as well as some very warm, oppressive nights to come. In fact, it was a warm, muggy night for many areas, and it looks like the Isle of Portland in Devon stayed above 20 degrees Celsius, making it officially a tropical night there. So warm, muggy, bright mornings, some murky conditions around northern and eastern parts, though, where it's cooler with some drizzle across northern Scotland. Most of that burns back towards coastal areas where the north and east coasts of the UK will stay quite cool. And it's not as warm across parts of Scotland, northern England, but another hot day elsewhere.
The weather, sponsored by Qatar Airways.
So remember your sunscreen if you are going out today, and also be really, really careful in open water. 3 people lost their lives in the UK yesterday. Do take care if you're out and about. Let me show you these pictures. 2 Syrian bears that were rescued from a zoo in southern Lebanon are being relocated to the United States after being kept in a cage for a decade. You've got to be kidding me. Homer and Ulysses will be able to walk freely and on grass for the first time in 10 years. They'll fly from the Lebanon to America, where they'll go to a new permanent home in a wildlife sanctuary in Chicago. They've no idea what is coming, but they most certainly deserve it. A decade in that cage. Why do people do that? Now, lockdown is easing in England, but how worried should we be about the spread of coronavirus? We'll talk to Dr. David Nabarro from the World Health Organization. That's next.
I'm Greg Milam, Sky's US correspondent here in Los Angeles. I've seen the dark side of America.
We are at a breaking point and we need to work now and fast.
Even though young people are vulnerable to the impact of climate change, young people can also become the change agents that we need to address the climate impact. In my campaign or in my advocacy work, I work largely with young people so that their voices can be heard, so they can also influence decision making from the local level to the national level. And thankfully, we are making progress in that regard.
Again, the government says a final decision will be taken today on whether to give COVID vaccines to under 18s. The United States and many European nations have already started offering the jab to teenagers. A short while ago, the Vaccines Minister, Nadhim Zahawi, told me he will make an announcement in Parliament this afternoon.
So the Joint Committee on Vaccination and Immunisation have just delivered their advice. We'll consider it. In fact, after my morning round, we have a COVID-0 and then I will make a statement to Parliament. But suffice to say, they've looked very closely, especially at children who are more vulnerable to serious infection from COVID, children who live with adults who are more vulnerable to serious infection from COVID, and of course, 17-year-olds who are close to becoming 18, so 3 months from their 18th birthday. And we will take that advice on board and I'll make a statement to Parliament later today.
Tomorrow's here. Jabs for kids then?
That's right. It's going ahead today, Nadhim Zahawi confirmed. But we understand that what the government is going to recommend is not jabs for all children over 12, as they are doing in the US, in Israel, in France, in Malta, but only those who are vulnerable or about to turn 18. Now, why that matters is because Professor Neil Ferguson, who obviously did all the modelling which led to the first lockdown, says if we're going to reach herd immunity, the level of immunity we need to see the virus start to decline, then that means we'll have to vaccinate teenagers in a big way. So question about whether, if you don't do that, given that the levels of transmission among young people and teenagers are very high at the moment, whether we're going to be able to get a grip on the virus this year. But Nadhim Zahawi said that one thing that the scientists on JCVI are concerned about is a very rare heart condition called myocarditis. So we may hear more about that in Parliament later.
OK, and a quick thought on masks?
On masks, yes, suddenly the government now think that TfL's policy of having masks is great. We've gone from we can't wait to throw them off to we recommend you wearing them to now wearing them is great. And that just shows really how spooked they have been by the huge rise in cases we've seen and predictions yesterday that we could see not just 100,000 but 200,000 cases by the end of the summer and potentially over 1,000 up to 2,000 hospitalisations. Ministers have never said what level of hospitalisations would threaten to overwhelm the health service, because obviously it depends where they are geographically and whether some areas are more affected than others. But certainly, I think the whole rhetoric of Freedom Day and the irreversible route out of lockdown seems to have fallen by the wayside.
At least for now. For now, thank you very much indeed, Tamara. Thanks. So we've been chatting to our teams up and down the country at railway stations, and they're telling us that anecdotally, about 80% of people who are travelling on trains today, at least, are wearing their masks. What will you do? Perhaps you'd like to tweet us and let us know at Burley. Lockdown restrictions might be easing in England then, but scientists are remaining concerned about the spread of COVID-19. There have been more than 48,000 new cases in the latest 24-hour period. Joined now by the World Health Organization's Special Envoy on COVID-19, Dr. David Nabarro, a friend of the programme. Hello to you, Doctor. Always great to see you. You think the government's doing this too early, don't you? Why?
Well, I want to be really clear with you, Kay. Of course, at some point, as ministers have said, we have to get on and get our lives going again. It's just what's our attitude while we're doing it. And so your summary just now of where we stand seems to me to be really important. There is no sense of freedom in my heart. Unfortunately, there's a sense that this virus is very much here and is giving us lots of surprises, lots of anxieties, and therefore, as a society, we go into the next period with our eyes wide open, knowing pretty well what to expect. That is more disease, more long COVID, and more challenges as to how we actually behave. My recommendation is simply wear your mask. Don't get too close to people. Watch out in confined spaces. And remember, this virus hasn't gone away. If you're asked to isolate, please isolate. And just let's get through the next 2 or 3 months with the minimum possible damage, and at the same time working out how to get on with our lives despite the presence of this virus.
You say if you're pinged, then you should self-isolate, but I'm sure you've seen the figures, Doctor. 1.7 million people in the United Kingdom are self-isolating at the moment. They're having to change the rules for NHS staff, otherwise our hospitals will be overwhelmed. There isn't enough food on supermarket shelves. At what stage do we have to say people do need to go to work?
Well, I think actually people are going to have to go to work now. I accept all that, and that some measure of rethinking all these issues like self-isolation is obviously happening right now. Look at the debate that happened yesterday around the contacts of the health secretary. So what I'd like to suggest to everybody is anticipate strong and consistent messages from government and others in the next few weeks. I think everybody throughout the world is coming to terms with what this virus means. It's not a case of just saying we've had enough, we're going to go back to normal. We've actually got to together establish what the new normal is like. And I think there will be a good new normal for all of us. We'll be able to connect together and get on with our lives. But for the time being at least, while a lot of us are still to be vaccinated, we've got to do everything possible to reduce the rate of build-up of this virus and be ready for new variants coming along, because that will be a big challenge for the months to come.
Yeah. So are you saying the COVID-19 app needs to be looked at and tweaked or not? Is that what you're saying?
Well, I'm going to say the government will need to consider how to deal with the people being requested to isolate, and there are options on the table. What matters, and it was clear from announcements over the weekend, what matters is that this is done quite quickly and in a clear and unequivocal way, so that everybody everywhere knows what to do. I think that is the hardest part of moving from a period of restrictions to a release, is that everybody needs to be absolutely clear in their own minds what they may do and what they may not do. And it's that consistency of guidance that's going to be really critical, not just in the UK, but everywhere. It's actually throughout the world now.
Yeah, we're out of time, but my viewers would be furious if we didn't ask how your grandson is.
Well, I saw them on Skype over the weekend. Absolutely brilliant, sort of strong and together. But gosh, I'm missing them. And there's one, as you know, I haven't seen. But with the new constraints coming in, it may be still more time before we can meet. Isn't it challenging, just wanting to get on with the normal things of being together, and this virus just keeps making life difficult for us all?
Hopefully soon, Doctor. It's always great to see you. Thanks for taking the time.
Thank you. Thanks very much. Bye.
Thank you. Care homes have suffered more than most during the pandemic. In England, more than 40,000 residents have died from COVID-19 and homes have been under strict lockdown. From today, however, limits on visitor numbers have been lifted. Joined now by Steve Dorrington. He is the owner and operator of Dorrington House Care Homes in Norfolk. Hello to you. Thanks for joining us on the programme this morning. What changes will you see as a result of these restrictions being eased?
Well, I agree with some of the speakers that I've heard already, and we're proceeding with caution. I'm pleased for the families. No one's mentioned that. The chap Jeremy from Four Seasons, he was saying it's sort of steady as you go, testing, we're maintaining hygiene, and we're still wearing the masks for the time being, and we're watching with bated breath.
And what do you want people that are coming to visit, whether it's loved ones or others, to see your residents? What are the rules for them? Do they still need to wear masks?
Yes, they do, and they're tested as well. And if not, they email us with proof of being tested negative. If not, we will do lateral testing anyway when they come in through the door. And what is interesting, we've got 3 homes. One is at Watton. The other end of the high street is a meat processing factory which had 350 cases. And because we had the vaccine before Christmas, due to a pilot scheme by the local surgery, we were ahead of the game there, and we had no virus there at all. But at the other 2 homes, we did, Dereham and Wells Next to Sea. And what's further interesting is we have had 3 staff at Watton, youngsters who we can't control when they're at home, out of our sight, and they tested positive. They weren't unwell. We're testing all the staff and the residents. They're all negative, and those 3 members of staff, and they're back negative as well.
Steve, how worried are you about your residents being affected, even though they've had 2 vaccinations and potentially a booster in September, that they could still be caught up in the next wave of this virus? We've seen the Health Secretary, of course, he's had 2 vaccinations and he still contracted the disease.
Yeah, that's a fact. If you've had 2 jabs, that doesn't exonerate you from infection. We're very careful. We're getting a lot of requests for respite care. We're very diligent with the hospitals, and they are quite cooperative now. Everybody's learning, and we are insisting that they're clear when they come into the home. And the residents themselves, those that with capacity, they are understanding, and so are the families. They've been quite cooperative. There have been some, altercations with families, not very many, and we still have got staff that won't be vaccinated, which is a problem. But
I wanted to ask you about that, Steve.
Right.
Yeah, I wanted to ask you about that because there is a suggestion that care home staff should be mandatory for them to be vaccinated. What do you think?
Well, personally, myself and my family have had it, and I'm all in favour of vaccination. And I have tried to persuade the staff. There's various reasons, as we don't want to go all over again, culture, fertility. And they're made well aware of it. And I'm watching those in particular with because we're COVID tests when they come back. I see them all, and I'm monitoring that they're negative. But I don't know how we're going to enforce it by law. We've got basically until February, if you include the 16 weeks. If we still have a big issue with 100,000 cases plus and hospital admissions going up, then maybe the government will have to get tougher with the population, because there are still a lot of people out there that won't have the jab.
And do you feel, as far as your homes are concerned, or care workers, that it should be mandatory if they won't do it themselves?
Yes. Human rights, if you want to go on holiday to some countries, you have to have various vaccinations. If you're a GP or a doctor in the hospitals, you have to have various vaccinations as part of your job. But it's a bit like jumping on the last dinosaur egg. If we start picking and choosing who we employ, there's not going to be anyone left.
OK, it's good to talk to you this morning. Thank you so much for joining us this morning. Thanks a lot.
Keep on caring.
Absolutely, absolutely. We heard from the Vaccines Minister earlier on today, find out what he had to say about wearing masks, about children being jabbed, and what he thinks about Prince Charles not wanting to wear his mask. All of that to come very shortly.
Did you know symptoms of hay fever can develop at any stage of life, not just in childhood? The Pollen Reports, sponsored by Philips Connected Air Purifiers.
Warm spells of sunshine will develop across most of the UK and Ireland today, and it'll be very warm or hot again across many central and southern areas. However, Scotland and northern England won't be as warm, and it'll be cloudy and cool with some drizzle over northern and eastern coastal counties. Pollen levels will be high for most areas today, except across northern Scotland, where they will be moderate. We are now in the peak of the grass and weed pollen season, and fungal spores are at their peak too.
The Pollen Reports, sponsored by Philips Connected Air Purifiers.
Freedom Day, how are you feeling about it? Well, nightclubs have been closed longer than almost all businesses during the lockdown. But at midnight last night, the doors reopened in England with no masks or social distancing. A warning that this report from Jemima Walker does contain flashing images.
The moment they've been waiting for. This, the first few seconds of July the 19th. Egg in London was one of the first nightclubs to close. Now it's one of the first to reopen.
I'm buzzing. It's been a long time for I'm buzzing to be back. Literally what you say. I can't wait. It's going to be lit, isn't it? It's going to be lit.
I'm really excited, yeah. It's just, obviously it's been such a long time and I just want to get on the dance floor.
I just feel like it's a good experience to have nightclubs again. I feel like I've been robbed.
For the 19-year-olds here, it's their first time inside a nightclub.
It just feels like we haven't lived the last year and a half.
Yeah.
Like all of the people older than us have told us, our whole lives about going clubbing and dancing and growing up in that way, and we haven't had that. So we're about to have it and finally feel our age, you know what I mean?
For parts of the nighttime economy, getting to this point has been no mean feat. Charlie Jilks owns 11 nighttime venues.
Pinging has been a complete and utter nightmare. It's almost locked down by the back door. 3 of our venues had to close for 10 days.
The government now advises nightclubs to ask for proof of double vaccination or a negative test, but it's not mandatory. And there are questions about the practicalities.
That was brought up very late in the day by the government, by which time we'd already taken all of our bookings. I think it's, at the moment it's impractical because, most of our clientele are under the age of 30 and they haven't had their second jab yet. I think a lot of people go to a nightclub as a spontaneous thing.
Some, of course, feel it's too soon to be rubbing shoulders with strangers on a dance floor. But for many, this day has been a very long time coming. Jemima Walker, Sky News.
I have to say, on my way to work this morning, there were an awful lot of very relaxed people looking for cabs in central London. Let's speak to the Chief Exec of City Pub Group, and that's Clive Watson. Hello to you, Clive. Thanks for joining us on the programme this morning. How are you feeling about restrictions being lifted?
Mixed emotions, to be honest. I think it's great that, for instance, nightclubs can reopen, but, having staff being told that they don't have to wear masks, I don't think is a good thing. And we're actually going to tell our staff encourage the staff very much to wear masks and carry on with a lot of the safety measures that we've already got in place at the moment. So it's mixed emotions.
What about your customers? What do you want them to do? What precautions do they need to take?
I just want our customers to respect our staff. I want them to come into the pub and not have a free-for-all. I want them to go to the table, order their food and drinks either on our City Club app or wait for table service, not to have a big scrum at the bar, not to abuse staff if they're wearing masks, just to respect everyone inside that building, because at the end of the day, what we're trying to achieve is the safety for customers and staff alike.
Do you want your customers to wear masks?
No, that's impractical because obviously they'll be eating and drinking. But
when they're
again,
moving around the
if
pubs.
they're coming into, yeah, definitely, I'd encourage it. I'm not going to enforce it, but I'd encourage it. And as I said, it comes down to respect. And if people customers don't like the idea of our staff, whatever, wearing masks, then I suggest they go somewhere else. This is about the welfare of everyone inside the building.
The Prime Minister had heralded this day, 19th of July, as a big freedom day and all the shackles of COVID-19 would be tossed to one side. Speaking to my guest this morning, I'm not getting that impression at all. People are still very cautious, very concerned about what else this virus might be able to do to us as a nation.
Yeah, look, when he set the Freedom Day, whenever it was 4 months ago, obviously we thought we'd be in a better place than we are at the moment. But we're now, cases are rising, as we all know. And yes, that rise in cases creates more caution, more concern. So, yes, as I said, it's mixed emotions. Is today the day of celebration? In some ways it is, because festivals and nightclubs can open. But it'd be much better if some of the safety measures were still government regulated than self-regulated by different venues.
And you still want people to use the COVID app, do you, to check into the pub? So if they're pinged, everybody else in the pub will have to self-isolate. How are you feeling about that?
Well, we're going through that at the moment. So, that's a third of our pubs have been affected by the things we just talked about. And we're getting lots of cancellations from customers, and particularly in group bookings, where some of them have been pinged or actually got the virus. So, that's just something we've learned to live with before, and going to have to learn to live with until this pandemic's behind us.
And are you chilled with people coming to order at the bar, or do you still want table service? Basically, what happened yesterday, you still want that to be in place today?
Definitely. I mean, we're not going to be militant and say you can't come to the bar, but we're going to have people in front of our pubs as they come in, guided towards tables, encouraged to use the app, encouraged to wait for table service. We do not want a whole lot of people charging to the bar, 3 deep at the bar. And that's only going to increase the number of infections and also, as I said, compromise the safety of our staff.
OK, Clive, good to talk to you. Thanks for joining us this morning. Appreciate it.
Thanks so much.
Thanks a lot. Quick look at what's happening with the weather. It's going to be another scorcher.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Good morning. It was hot and sunny across many parts of the UK and Ireland over the weekend, and the heat continues for this week as well. In fact, it moves further northwards across northern areas. Yesterday, it wasn't as warm, and it won't be as warm for today, but eventually that heat will reach parts of the north where it will be hotting up as well. It's been a warm and muggy night as well. A bright start for many areas, but some northern and eastern parts a rather cloudy, murky, cool start for this morning. But the murky conditions and the low cloud burning back towards coastal counties of the north and east, where it remains cooler throughout today. Across northern parts of Scotland, cloudy with some patchy drizzle. Elsewhere, though, lots of sunshine developing. Yet again, another very warm or hot day, particularly across central and southern areas. Temperatures will be hovering around 30 to 31 degrees Celsius. Not as warm for inland parts of Northern Ireland, Northern England and Scotland, but still a fine day there and largely dry.
The weather, sponsored by Qatar Airways.